Hi friends, welcome back to my channel, and yes, thank you so much for liking and subscribing to my YouTube channel. And those who are new, please do subscribe so that you don't miss out on any of the informational podcasts as well as our weekly guest interviews. So today it is the episode 14 in our series of guest interviews. And yes, as friends, we adults face any health issue. First, we try to tolerate the pain, and then we'll apply some home remedies. And if it gets severe, then we visit the doctor who can help us with it. Suppose if it's related to our teeth, we go to the dentist, ENT specialist for ear, nose or throat, and orthopedic doctor for bones, and so on. But when it comes to our kids, we must immediately, without any delay, visit a pediatrician because they deal with the health and medical care of infants, children and adolescents from birth up to the age of 18. Small kids, toddlers and babies cannot tell or express their problems and discomfort properly. Maximum what they can do is cry or they behave in a cranky way and irritate us. But then we cannot understand what is going on inside them. So that's where a pediatrician plays an important role in the life of these little humans around us. So yes, friends, to tell us more in detail about all these things and how to handle our children and when and how to visit a doctor, for what all reasons we need a pediatrician, we have our guest today, Dr. Sivaranjani Santosh, who is a pediatrician from Magna Center, Nagar, Hyderabad. So hi ma'am, thank you so much for coming to my YouTube channel.
Hi, thank you for inviting me.
Thank you ma'am. So yes ma'am, I've gone through your profiles and I've seen there are a lot of mentioning about mission first aid. So first of all, I would want you to elaborate about this topic.
Okay, so basically first aid is something, if given at the right time, in the right way, it is something which can save 6 people from dying. Out of 10 people who are dying, 6 people can be saved. Okay, so
Right.
that means 60% of deaths can be prevented by giving the right first aid at the right time. Unfortunately, in India, hardly anybody knows to give first aid or CPR. So I realized this very early in my practice. So I started training parents in first aid and CPR. The first aid for choking, first aid for seizures, and how to give CPR. All this I started training parents.
Oh, okay.
I started training parents in all this. Then slowly now, school started asking me to train the teachers. So then the colleges. And now, like, I can proudly say that I would have trained around almost 15,000 people directly. And through my channels, through my posts, through the videos that celebrities have shared.
Wow, that's really nice. And so yeah, like you said, these are very common issues that parents face, like suddenly the child swallows a small peanut or a coin. So these are like very common issues among the toddlers.
May I interrupt?
Sure ma'am.
Yeah, swallowing is different.
Mm-hmm.
Choking is different. Swallowing means it's going into the food pipe.
Yeah, exactly. Yeah, that's what. When it is not inside the stomach and neither it's in the mouth.
It's in the wind pipe. If it is going into the wind pipe, the pipe through which we breathe, and it obstructs our breath, then we call it as choking. Choking can kill us in seconds to minutes. So if we give the right first aid at the right time, the child will be saved. There was an incident a couple of years back when a child from Telangana choked on a chocolate and died.
Oh my God.
That video was shared extensively, like millions of views. But when it comes to, those people who have shared the video, I doubt if even 1% of them actually went back and said, okay, this should not happen to my child. I learned first aid for choking. I doubt even if one person has done that. So I really earnestly request all parents to be thorough with first aid for choking and seizures, and ideally even no CPR. And secondly, accident prevention is even more important than first aid.
Correct.
So
That's what...
please do not give peanuts and whole nuts to toddlers. That's not right. Even if you are very proud that your child is able to chew and all, don't give whole nuts. That's the guideline.
Correct.
Minimum age is 4 to 6 years to give whole nuts.
Oh,
so,
okay.
Yeah. So accident prevention is even more important.
Right. And like, is the only reason that the piece is bigger than that they can chew, or is it like if they have a dry mouth, or like the child is talking, or any other actions the child is doing?
Yes, anything which is hard and rounded and easily, or hard chunks. These are all choking hazards because child cannot chew it properly, and they can easily roll and move suddenly into the windpipe. And second thing is, we should not talk or laugh or anything while eating. We have to focus on eating. So firstly, the adults in the family have to set an example by chewing nicely and swallowing the food before talking.
Correct.
So the same culture we have to,
pass on to our child.
Yes.
True, ma'am. True. Yes, ma'am. So now coming to children, usually like once they start going to school, it is very common that they catch cold, cough, and sometimes fever also. And in many cases, I've seen that parents are like they have by-hearted the medicines that the pediatrician prescribes. So again, if they get cold or cough or even for fever, they will just directly go to the medical shop and get the medicine, or else they will do some home remedies. So in this case, what would you suggest that at what point should they go to the doctors? Because even I've seen cases where the fever goes very high and then it becomes a risky thing for the child.
So, see, firstly, we'll take the fever topic.
Yes, ma'am.
Okay. Fever.
Yes,
Fever is just a manifestation of something happening inside the body, mostly a disease or an infection. Okay. So, it is most of the times harmless. Okay,
Yes.
but if fever is rising very fast or if it's very high, then it can have detrimental effects on the child. Between 6 months to 6 years of age, some children can throw a seizure when they have a fever, especially when it is rising. Okay. Right? So the parents should not be like, very aggressive with control of fever. They shouldn't be like, I want it to be exactly 98.4 and all. So if the underarm temperature is say around 99 to 99.5 or more, or the ear temperature is around 99.5 to 100 degrees Fahrenheit, or the forehead thermometer shows around 99 degrees Fahrenheit or more, 99.5 or more, then they can give paracetamol. And the dose of which will be mentioned on the label very clearly. They should not be in a rush to give the medicine.
Right.
Okay. As per the weight, the dose will be mentioned on the label. Okay. They should not give the dose in a hurry-burry. Like for example, if doctor has prescribed 5 ml of Crocin 120 and they give 5 ml of Crocin 250, they would be giving double dose to the child. If they give 5 ml of Crocin 500 to the child, paracetamol 500, they would be almost giving 4 times the dose.
Correct.
So they should not be in a hurry. They can just check on the label, the dose, as per the weight, and go ahead. And minimum of 4 hours gap between 2 doses and maximum of 5 doses in 24 hours. They can sponge with lukewarm water, not cold water, only lukewarm water, and that too only if the child is cooperative, and that too only in the center of the body, the forehead, the groins, the underarms, etc. Okay, if the temperature is high.
Correct.
Right? That's one more thing they can do. And the second option, if the fever is not coming down at all, okay, it's not breaking, judiciously they can give something called ibuprofen the dose of which every year they can check with their using it. Like they won't aggressively control the temperature. It is not at all recommended to use it so much. If you have ibuprofen, prefer ibuprofen. If you don't have ibuprofen and the temperature is going too high, maybe judiciously one odd dose of mefenamic acid available as Meftal, and that to the right dose, not to be given on empty stomach, not to be given if the child is having stomach pain or severe vomiting. Okay, too many doses can themselves precipitate seizures in some children, rarely. So, and please avoid giving combination drugs like Meftal, and that too, please do not give any of these strong medicines like too liberally. Use them judiciously, and if you are ending up needing to use these strong medicines 2 to 3 times, then definitely it's time to consult the doctor. That means the child's fever is high and it's not getting controlled with paracetamol. Definitely the pediatrician needs to look at the child. And they also need to meet the pediatrician if the child is very dull, not feeding at all, very irritable, very drowsy, lethargic, is having breathing difficulty, crying incessantly, and hands and feet are cold. Or if the child has seizures, obviously you have to go to the emergency. And if the fever persists more than 5 days also, they need to consult the pediatrician. And as I said, between 6 months to 6 years, there is a high risk of seizures, right? So the parent needs to be thorough with the first aid for seizures. The parent needs to hydrate the child very well. There is this video of mine on Dr. Sivaranjani's Easy Health YouTube channel where I have mentioned about what type of liquids to give during fever. They can watch that video. In that same video, I mentioned about the type of liquids that need to be given in diarrhea and vomiting and what not to be given also. So the parents need to go through that video as well.
Sure. I'll mention the link, ma'am, in the description as well. So, yes, ma'am, we were also talking about cold and cough. So, is it okay to go with the home remedies or the known medicines, or do we need to visit the doctor always?
See, there's a saying that cold and cough, if you give medicines, it will go away in 7 days. If you don't give medicines, it will go away in a week. Okay. Yeah. So there's no major medicine that can take away the cold and cough. We can only address the cause of the cold and cough. For example, if it is certain germ which is causing severe cold and cough or, high fever, we can kill the germ by giving the appropriate medication. But we can provide symptomatic relief. So if it is too bad and the child is not able to breathe, or if the child is wheezing, based on the symptoms and signs, we may be able to help the child. So coming to the causes of cold and cough, the common causes are weather changes, temperature fluctuations in the house, like you use AC for some time, you don't use.
So, yes, ma'am, when the kids start going to the school, so again, another common infection that they get easily is the urinary infections. So, how can we
Urinary infections.
Urinary infections, yeah. So, how can we in the initial stages, how can we avoid such infections? Because obviously,
school going may contribute to it. I'll explain how. Okay.
Yes,
so there is something called vesicoureteric reflux. That means there is a condition which happens by birth only. So when the baby tries to pass urine, instead of the urine, the total urine coming out, some of it goes back towards the kidney. So those babies who have this underlying condition by birth, they are more predisposed to urinary tract infections. So it has got nothing to do with school going. So some children who are constipated, they have a higher chance of developing urinary tract infections. So
Oh.
children, many of them, they don't like to use the bathrooms, the washrooms in the school, the toilet. So they stop. Even if they want to pass stools, they stop it. They stop the urge. Okay. So they get constipated, and that predisposes them to urinary tract infection. And the third thing, especially with regard to girl children, many of them are going to school at an age of or daycare centers at 1 year, 1.5 years, 2 years, 3 years. So all these children who are still not knowing how to clean themselves. So if the caretakers don't take care properly and the stool is retained in that area, especially with regard to girl children, then also there is a higher chance of urinary tract infection. Okay, and the direction of cleaning is also very important. So, especially with regard to girls, always the cleaning should be front to back, not back to front. So we should not push the stool material towards the urine passage. Okay, so all these things need to be taken care of, and the child needs to be well hydrated. If we ensure, if we know that the child doesn't have vesicoureteric reflux, and the child is well hydrated, is not constipated, and the local care, the care, after passing stools and all, the area is cleaned well in the right direction, the chance of the child developing urinary tract infection is very less. There are certain other conditions in boys called posterior urethric valve and all that, but it's beyond the scope of this discussion. So that also can predispose the child to have urinary tract infection. The other condition we are seeing commonly, which is getting missed out nowadays, is something called, and also in boys, if the foreskin is very tight, sometimes it can cause urinary tract infection. And if there are stones in the urinary pathway, urinary tract, then also there can be a urine infection, and that dehydration worsens the risk. And in girls, there is something called labial adhesion, wherein the area near the vagina, is there are two small lip-like things on either side of the vagina. They are called labia minora. If they are adhered to each other, they're sticking to each other, then there won't be enough space for the urine to pass out easily. So then also we see that some girl children with this condition developing urinary tract infection. So any child with recurrent urinary tract infection after first birthday, or any child with urinary tract infection, even if there is only one, the incidence is only one, they need to definitely consult a good experienced pediatrician or a pediatric nephrologist.
Correct. Yes, ma'am. So another point of concern today among the kids is the child obesity. Even though if the parents are following the proper food routine and all, but still we get to see many children who are very obese. So what may be the reason behind this, and how to avoid such situations?
About obesity?
Yes, ma'am. Child obesity.
Yeah. Obesity, you only know why it happens with us. So from the beginning, the main psychology with parents, and more than parents, with your grandparents, is that we need to keep feeding the child. So they will distract the child and feed, or they'll force feed. So invariably, they are actually starting the obesity risk. They feel, most of the times, they feel that the child is not eating enough. First of all, we as parents need to understand that no child will go hungry. Okay, so respect the child's appetite. Quality of food, parents need to plan. Quantity only the child will decide.
Mm-hmm.
Okay, so if the child says, I'm not hungry, stop there. If he says, I'm full, stop there. But plan a good quality food, like balanced diet. Okay, so don't distracted feed, don't force feed. That is first thing. Okay, if you feel that your child is not growing well and is definitely not eating well, yes, let them look into the cause for poor eating and then address it accordingly. Never ever distract the child to feed him, nor hit the child to feed him or force feed him. Okay.
Correct.
Second thing is, we know that like now we have access to so many foods. Most of us, we order more from outside, like compared to what the earlier
Right. Yes, ma'am. While talking about this child obesity, another thing I wanted to ask is it majorly because of the genes that the child has, which affects on the weight and height of the child, or even if the parents are obese and the height is, shorter than the normal height, but still we can develop the child with normal weight and normal height?
See, to some extent, genes do play a role.
Mm-hmm.
Okay, so if my parent is obese, I have a higher chance of being obese. That doesn't mean that I take it for granted that I'll anyway be obese, so I won't, take care of my diet, I won't exercise.
Mm-hmm.
So if we really work on it, we can still stop ourselves from becoming obese.
Correct.
So genetics do play a role, but we can circumvent the problem by being more conscious of the food we eat, the quality of food we eat, and by ensuring good physical activity.
Right. Yes, ma'am. Another major concern among the parents, especially parents of girl child, are the early puberty among the girl child. Like almost by the age of 8 years also we are hearing the cases where the girl childs are attaining puberty. So can you explain the reason for this, ma'am?
So by definition, the appearance of pubertal signs before the age of 8 years is defined as precocious puberty in a girl child.
Okay.
By pubertal signs, we mean hair in the pubic area, enlargement of breast. Okay, hair in the pubic area, enlargement of breast, and later she'll start her period, basically. Okay, so there is a generic shift all over the world. There is a generic shift. Okay, so the girl children are definitely getting puberty early. That's why before 8 years now it's defined as precocious puberty. Okay. So there are lot of hypotheses about why this is happening. Okay, so the most commonly accepted hypothesis is that the endocrine disruptors are a major cause for this. Endocrine means anything hormone related, gland related.
Correct.
Okay, and all these parabens and other chemicals we are using in our body cream. Okay, and plastic, BPA and all is plastic. All these, and cement, the materials they use in cement and all. So all these we are and the chemicals in household cleaning liquids. All these chemicals, we are breathing them day in and day out. We are applying them on our skin. And people are saying that these are responsible for most of the problems. Hello?
Yes, ma'am. Right.
Yeah. And there are some things called phytoestrogens. Phytoestrogens. Okay, so soya is being implicated as a phytoestrogen. So too much of soya also can cause precocious puberty is what is being said, but the proof is very bleak. Okay, not so strong as it is for endocrine disruptors. Okay, the other hypothesis is that the hormones given to hens and all and cows and all are also responsible for precocious puberty is what is being said. Okay,
Right.
so the poultry, the eggs, the chicken, the dairy and all that. But again, American Academy of Pediatrics and other academies of pediatrics, they say that the proof is again not enough to say that this is responsible for precocious puberty. So,
Correct.
as of now, the commonly implicated factors are, as I said, the chemicals, the extra unnecessary chemicals in our body creams and pesticides that we are eating through our food, the chemicals we are breathing in, all these things.
And like also if the girl child is overweight, is that also the reason that they attain puberty at an early stage?
Yes, obesity can predispose to precocious puberty. Obesity can predispose to polycystic ovarian disease. Obesity can predispose to lot of skin pigmentation issues. It can predispose to diabetes, joint-related problems, cholesterol-related issues, and future risk of heart disease also increases.
Right. Yes, ma'am. So, in our one of the previous questions, you answered about how to feed the child, that there should not be forced feeding of the child. So, regarding this, I would want to know what are the major mistakes the parents are making related to food and nutrition, especially with the babies. Like there are a few people who follow giving water to the babies just when they are 2 or 3 months old, and once they start eating solids, like 6 or 7 months, they give them some biscuits. So I just want you to tell us which is like right way to feed especially babies below 1 year.
Introduction of solids below 1 year, that's what you said?
Yes, ma'am. Solids and also the giving of water, those kind of liquids below 6 months.
Below 6 months?
Yes, ma'am.
No. The recommendation by Indian Academy of Pediatrics, American Academy of Pediatrics, Australia, you take Canada, anywhere. Now the recommendation is very clear. From 6 months of age, that means 6 completed months. Okay, that is when we have to start solids. And when we start solids, initially it will be mostly breast milk or formula milk, which forms the main source of nutrition for the baby, and we gradually introduce solids very, very gradually, and we offer a couple of spoons of water after the solids just to clean the mouth. Only as the solids increase, as the solids form predominant part of the diet, parallelly we increase the intake of water. Not below 6 months. Below 6 months it's only milk and only milk.
Okay, ma'am. And yes, ma'am, keeping the climate and weather in mind, I would want you to give some tips to the parents how to avoid dehydration in kids these days.
What?
Ma'am, about dehydration because of the weather right now. How can we prevent dehydration among the kids? Like, because obviously they will not have so much of water, like even if we offer them. So what other things can we do for dehydration?
Dehydration.
Yes,
dehydration needs to be addressed on an urgent basis. So when a child is losing water through stools and vomit, it's not just water, they also lose salt.
Right.
And they get dehydrated. So we need to continue replacing these liquids that they are losing. So ideal liquid is WHO recommended formula oral rehydration solution. So in the market we get lot of things called ORSL, Ribalance with ORS. These are not correct ORS. They have very high sugar content which will actually worsen the diarrhea. They have permission from FSSAI, not CDSCO. So people, parents should not buy these liquids. They're very dangerous to be given during diarrhea and vomiting. Very dangerous. You know, diarrhea can and dehydration can lead to death.
Correct,
Okay,
right,
so WHO recommended formula ORS. And in between they can give plain sips of water, but predominantly WHO recommended formula ORS, buttermilk, okay,
yes,
and lemonade, etc. with no added sugar.
Okay.
So how they can prepare ORS at home in case, see, if you have the pre-prepared one, that's the best. So we have 200 ml sachets and 1 liter sachets. So they have to read the instructions on the label. For 200 ml sachets, they have to empty the content in 200 ml. For 1 liter sachet, they have to empty the content of the sachet in 1 liter water.
Right.
And use it for 24 hours. Even if they want to buy Tetra packs, they have to make sure it's a WHO recommended formula ORS only. And at home, how they can prepare it is half teaspoon of salt, only teaspoon, level teaspoon of salt, and 6 teaspoons of sugar in 1 liter water. So they can prepare ORS. And they can even give soups, ganji, etc. for dehydration. And next even coconut water is okay if these are not available. But do not give Glucon-D, sugar water, glucose water, ORSL, rebalance with ORS, all these things which are not actually ORS.
Right.
Okay, breastfeeding to be continued, and if baby is very dependent on milk to be continued. Okay, but do not ever stop breastfeeding.
Okay, ma'am. Okay. So yes, ma'am, we will conclude the session with some general tips or suggestions that you would want to give to the parents, as you would have noticed many cases and many issues in your... Ma'am, I would like to conclude with some general tips or suggestions that you can give to the parents based on the issues or cases that you have seen among the children. Any general tips and suggestions?
Parents need to be empowered with the right knowledge about accident prevention, first aid and CPR. They need to understand that medicine is not the solution for everything. Medicines have to be used very judiciously only after checking with the doctor. They should not abuse antibiotics and steroids. Definitely no. That will ultimately prove to be a danger for the children if they abuse antibiotics and steroids. At the same time, when a qualified doctor suggests antibiotics for a particular reason, they need to complete the course. Okay. And when it comes to parenting, they have to understand that the child is an autonomous individual. They should not try to control the child or rub their ambitions onto the child. Okay, so communicate with your child very well. Then definitely your child will grow up to be a great human being. And what I would say now, it's going to rain and a lot of infections are going to start. Mosquitoes will cause dengue and all these issues. So please watch my videos on dengue and prevention of mosquitoes, protection from mosquitoes on my channel, Dr.Sivaranjani Easy Health YouTube channel. Eat well-cooked food, hygienic food, protect the food from flies, and good water. Hygienic water. This is also very important. If your child has fever, cough and cold, please do not send the child to school. You are not only troubling your child, you are actually exposing so many other kids to infections.
Correct.
Yeah, that's it.
Thank you, ma'am. Thank you. So yes, I will definitely put on your YouTube channel details on the screen as well as in the description. And I would want my listeners to contact you in case they are from Hyderabad, or also online consultations are available. So thank you once again, ma'am, for your time and excellent words of advice regarding all the issues related to the kids' health. And actually, really having a good pediatrician around us is a blessing for all the parents, and I think everybody will agree with me. And plus, a doctor with a social message is again a unique combination, which is again a boon for our society. So thank you once again, ma'am, for coming to my channel.
Thank you, Ashwita. Thank you so
ma'am.
much.
Yeah, thank you. Bye.